Women's Hospital delivers more than 8,000 babies a year, and we're excited to welcome you and your family to our campus. We know you have questions, so here's what you need to know about having your baby at Women's. It's all in the prep. All OB patients should complete hospital registration within 45 days of their due date, so you don't have to do this while you're in labor. OB Express is available online at womans.org/registration, in person in the hospital admitting office or in the medical office building lab, the same building where your doctor's office is located. Also, your privacy is important to us, so we let you decide just how private you want your stay to be. During registration, we will ask you if you want to be included in our hospital phone directory. If you answer no, we will not release your information or room number to anyone, including family, friends, florists, and clergy. We leave it up to you. When your labor begins, your first call should be to your doctor, who will tell you your next steps. If you're instructed to go to the hospital, remember to bring all paperwork and your insurance card. When arriving at Women's, drive under the Assessment Center canopy. Let our team know that you are in labor and we'll take it from there. Depending on the stage of your labor, you'll be observed in the assessment center by our physicians and nurses until it's time to go up to labor and delivery. We will keep your doctor informed of your status while you are here. If you have a scheduled C-section or induction, you will check in at the admitting office on the first floor of the hospital. Please call the hospital an hour before you leave home so you don't have to wait. In our labor and delivery unit, we have the latest technology to care for you and your baby, including fetal monitors in the room and at the nurse's station that monitor your contractions and the baby's heartbeat. Also, you'll notice a lot of additional measures in your room, including a comfort menu to help you manage your pain while in labor, TVs to tune in relaxation music, stream through your phone, or watch educational programming offered in English and Spanish, an individual thermostat to adjust the room temperature, birth or peanut ball, and a laboring tub, which will require a doctor's permission to use, a special delivery bed, a baby warmer for when your baby arrives. After your baby arrives, we will encourage skin to skin immediately. Following Magic Hour, other assessments such as footprinting, weighing, and measuring will take place. Your baby will stay in your labor and delivery room with you while you both recover, which is usually about 2 hours. Then you'll be moved to a private room in the mother-baby unit. A C-section can be planned or can occur immediately due to complications with mom or baby. This is a surgical procedure. If you are having a scheduled cesarean birth, you will be prepped for your procedure in a prep recovery room. Once you are in the OR, you will be given an epidural and a catheter will be placed in your bladder. Your stomach will be washed with an antibacterial solution, and sterile drapes will be placed over your body so that your stomach is the only area exposed. Your doctor and the delivery team will be in the room with you, along with an anesthesia nurse seated by your head to keep you comfortable and answer questions during delivery. After delivery, you'll return to your room and will be given your baby to hold, skin to skin, while you both recover. Then you'll be transferred to a mother-baby room for the remainder of your stay. If you have a high-risk pregnancy or if there are any maternal complications during labor or delivery, you might be sent to our high-risk unit for a short period of time after delivery for additional monitoring until you are stable enough to move to a mother-baby room. You've welcomed your bundle of joy. Now it's time to get to know one another. You'll spend the majority of your time in Women's mother-baby rooms, which are designed to give your family's first few days together the best experience possible. Now is the time to bring all the items you packed upstairs for mom and baby. Each room is large and equipped with a private bathroom, a glider, and a sleeper sofa for your overnight guest. One adult support person guest may stay overnight. You and your baby will have your own nurse who will explain everything you need to know about postpartum care, including how to take care of yourself and your baby and what to expect after you go home. Feeding your baby will be the most important role over the next few days, and our lactation staff will visit you each day to assist with breastfeeding. Once you go home, you can call our lactation warm line, schedule virtual consults, and attend our breastfeeding support groups. Having your baby in your room helps you to learn how to best care for and learn his specific needs. You can also watch Women's TV for additional video information on newborn care. After birth, the first 6 hours of life are called transition, a time for baby to adjust to life outside of mom. If a baby is having a little difficulty adjusting, he may be brought to the transition nursery for closer observation. Should your baby require more intensive care, he will be transferred to the Newborn and Infant Intensive Care Nursery, or NICU. Woman's is a Level 3 regional referral center and is fully equipped to care for sick or premature infants who require constant monitoring. Be assured, if your baby is in the NICU, your nurse will keep you informed of your baby's status. We recognize parents are very important members of the care team. In fact, we've designated our NICU around family-centered care. Our single-family rooms allow intensive, personalized care while giving parents the space to spend quality time with their baby and learn to care for his medical needs. Woman's Hospital takes the safety of its patients seriously. We want to make you aware of our recommendations and policies. Never leave your baby alone or unattended. Never, ever let your baby sleep in the bed with you. Always place your baby back in his own bed. Do not give your baby to anyone without proper verified hospital picture identification and a secondary security badge. Do not take your baby out of your room. If you must leave the room, please notify the nursing staff. Always question unfamiliar persons who enter your room or inquire about your baby, even if they are in hospital attire. All of these measures are designed to keep you and your baby safe. Most patients are discharged 48 to 72 hours after delivery. The mother will be brought downstairs in a wheelchair while holding the baby. Carts are available to help your support person load belongings into your vehicle. There is special parking right outside the main hospital entrance for patients being discharged from the hospital. This is where your support person should bring the vehicle for you and baby. Before the baby can be placed in the vehicle, you must show that an appropriate car seat has been properly installed. It's a good idea to do this a few weeks before expected delivery if possible. We have shown you the main areas of the hospital that will likely be a part of your experience when giving birth at Woman's Hospital. We also have an attached physician office building that your doctor may be a part of, a high-risk maternal fetal medicine clinic that some of you may need to visit during your pregnancy, and an outpatient lab where we do blood work and perform screenings for gestational diabetes. If you'd like to learn more about Woman's Hospital or specific areas that were mentioned in this tour, visit us online at womans.org.